Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, welcome back. The doctor is in, and she continues to be. And of course, we are talking about kids' health, specifically tummy aches and growing pains. A very uncomfortable subject, doctor, but we will try and address many of these concerns. So, tell you what, let's go to our very first question. You ready?
Yes.
Okay, Samantha T. asked our first question, and she says, Dr. Jitka Lom, is it true that some children are sensitive enough to feel their bones growing? And if so, what can we as parents do to help relieve such discomfort?
Right. I think everybody's sensitivities differ. Some people really don't feel too much of anything. You know, they don't suffer a lot of pain in their lives, and other people are very sensitive, and that goes for our kids too. So yes, I do believe that some children are more sensitive than others, and you could soothe them with massage, with stretching their limbs, with a little bit of Tylenol, maybe just reassurance that they're growing and getting bigger, and we'll be able to do those grown-up things soon.
Calcium intake maybe has something to do with that,
sure,
perhaps.
Yeah.
Okay. Well, our next question comes to us from Shelley, and she hails from the northern village of Jigo. Shelley asked, Dr. Lom, my 3-year-old daughter is always complaining of pains in her legs, once again, during the night. You talked about this in our first segment. Could these be growing pains?
They could. The main thing is, does the child have a limp, or is the child okay during the day? If your child is perfectly healthy during the daytime, growing fine, eating well, running around, then there's no problem. And you can just monitor the growing pains and reassure your child.
Could there possibly be an imbalance in the length of legs and everything? I've heard really spare cases about that.
There could also be. That's a really good question, yeah.
Okay. Okay, our third question comes to us from Mr. Gogui, Robert Gogui to be in particular. He says, how can you determine, Dr. Lom, if it is growing pains or something worse, such as juvenile rheumatoid arthritis?
Yeah.
That even hurts to say.
It does. You know, rheumatoid arthritis in children is very uncommon, but it can occur, and those children will have pains in their joints, not in the limb, but in the actual joint. And there'll be stiffness and soreness and swelling, fevers, other symptoms like weight loss, fatigue, generally sick. Not just uncomfortable. And those children will have abnormal blood tests and x-rays also. So that's kind of how you tell. If your child is healthy, otherwise there's probably no problem, but if there are other symptoms associated, then they need a checkup. Okay,
and then maybe just for Mr. Gogui's peace of mind, is rheumatoid arthritis a genetic thing?
It does run in families.
Okay.
Yeah.
Okay, so there's some food for thought there. Up next, we have Mina L., and she sends this question, posted on our Facebook wall, Dr. Lom. She says, her son, who happens to be 11 years old, has had recurrent stomach aches for the past few months, at least twice a week. She says they range from dull to gnawing pains, and he's also always hungry. An hour after he eats, he's hungry again. That's a very strange case, and she says, should I be concerned?
I think she should be concerned, and it would be good to get him checked. The symptoms make me think about a peptic syndrome. That would be something to go along with ulcer, and ulcers are actually not uncommon in children. Mostly they're stress ulcers. They're due to taking too much Motrin, actually, for various sort of childhood symptoms like you know, colds or coughs or whatever when people give their kids Motrin. Or sometimes an infection with a bacteria called H. pylori. And so the children will be tending to self-soothe by eating to calm down their stomach, but their stomach will get full very easily, so they'll tend to sound like they're hungry all the time, need to eat again. So it would be important to have the child checked. There's also a funny thing called abdominal migraine, where children don't actually get headaches, but they get stomach aches in terms of being a migraine headache. Sometimes it's associated with vomiting also. So your child should probably have a checkup.
Okay, well hopefully that's resolved Mina L's concerns. That's pretty unfortunate there for the child. Well, Chris Pangolinan writes in our last question, as a child, drawing back to his youth, I remember getting stomach aches more frequently than I have as an adult. He also writes, I read that children get more stomach aches than adults, but can't remember why.
Yeah. It's funny. There's something called periodic abdominal pain in children. It's a syndrome where it will be a little bit during the early years, the early elementary years, and then quite common between ages about 8 and 12, especially in girls. And no one really understands exactly why. Some people think it's associated with anxiety or stress, for example, starting school or changing grades. And it can also be associated with constipation again. So kids can have very sensitive tummies, and we need to try to help them with it.
And it is possible to worry yourself sick.
Absolutely, for sure.
And
yes.
so there's a lot of psychological impacts that affect your stomach.
Yes, in fact, in recent years they've identified hormones that are present in the gut, and they're also present in the brain. They're the exact same hormones. So when you're mentally upset, you may get butterflies in your stomach, or a stomach upset, or even nausea or vomiting, just simply from stress.
Fascinating.
Yes.
Okay, well, thank you so much, Doctor. I know
Thank you.
people that send in these questions are greatly appreciated.
Thank you very much.
Okay, we'll see you next Tuesday.
Thank you.